In today's clinical environment, efficiency, safety, and infection control matter more than ever. Meet HurriCaine ONE with 4% lidocaine, a single-use non-aerosol topical anesthetic designed to deliver fast, reliable pain relief in one simple step. Each unit dose applicator provides a controlled amount of medication, helping reduce cross-contamination and eliminate product waste, while supporting accurate documentation with barcode tracking. With fast onset in about 5 minutes and relief lasting over 10 minutes after application, it's built for both performance and convenience. Using HurriCaine ONE with lidocaine is quick and easy. Clean the site with an alcohol wipe or facility-approved antiseptic prior to application. First, tear at the notch to open the pouch and remove the unit. Next, turn the sprayer clockwise to unlock it. Then, hold the device firmly. Place your index and middle fingers on the grip and your thumb on the plunger base. When ready, apply firm, steady pressure with your thumb to activate the spray. Apply directly to the treatment area. The anesthetic effect begins within 5 minutes and provides relief for over 10 minutes after application. For safe, efficient, and hygienic pain relief, choose the simplicity of single use. HurriCaine ONE with lidocaine. Efficiency and infection control in one smart solution. Learn more at nuancemedical.com/HurriCaine ONE.